For years, we've been told something very simple: more medical tests mean better health. But after the age of 70, that belief is not always true. In fact, medical research now shows that some routine tests, the kind many seniors get every year, can quietly lead to stress, unnecessary procedures, and even serious harm. Today, I want to calmly walk you through 5 common medical tests that may do more harm than good after age 70, and explain when they're helpful and when they're not. This is not medical advice. Always talk with your doctor. But this information can help you ask better questions and make safer decisions. Number 5. Carotid artery ultrasound. This test looks at the blood vessels in your neck to check for stroke risk. On the surface, it sounds like a smart idea. But for seniors without stroke symptoms, this test often finds small plaque buildup that is not dangerous. The problem begins after something is found. Many people are then sent for more testing, or even surgery, that carries real risks, including stroke during the procedure itself. Large medical studies show that in symptom-free seniors, this test almost never prevents a stroke, but it often leads to unnecessary interventions. Here's the important part: if someone has sudden weakness, trouble speaking, or vision problems, this test can be life-saving. But as a routine check when you feel fine, lifestyle habits and blood pressure control do far more to protect your brain. Number 4. Routine vitamin D blood tests. Vitamin D sounds harmless. Just a simple blood test. But in older adults without symptoms, routine testing rarely helps, and often causes overtreatment. Vitamin D levels naturally change with seasons, lab methods, and hydration. A low number does not always mean a real problem. Many seniors are placed on high-dose supplements, which can lead to kidney stones, high calcium levels, confusion, and heart rhythm problems. What most experts now agree on is simple: for many seniors, a modest daily dose is safer than chasing blood test numbers. Testing makes sense only when there are bone problems, frequent falls, or clear symptoms. Number 3. PSA test for men over 70. This one is especially important for older men. The PSA test looks for prostate cancer. But here's what many people don't realize: after age 70, most prostate cancers grow very slowly and never cause harm. The danger comes from what happens after a slightly high result. Men are often sent for biopsies and aggressive treatments that can cause loss of bladder control, sexual dysfunction, long-term emotional distress. Large studies show that PSA testing does not reduce death rates in men over 70, but it greatly increases unnecessary treatment. That's why medical guidelines advise against routine PSA screening at this age. If symptoms appear, like difficulty urinating or blood in the urine, testing makes sense. Without symptoms, routine testing often does more harm than good. Number 2. Routine EKGs. An EKG measures your heart's electrical activity. It's quick, painless, and very common. But in seniors without heart symptoms, routine EKGs often find normal age-related changes, not disease. Unfortunately, those harmless changes can lead to stress tests, advanced scans, invasive heart procedures. Many older adults end up hospitalized for tests they never needed, all starting from a routine EKG. When chest pain, shortness of breath, or palpitations are present, an EKG is essential. But as a routine check when you feel well, monitoring blood pressure, cholesterol, and daily activity is often more useful, and much safer. Number 1. Routine chest X-rays. This is the most overlooked, and most risky, routine test for seniors. Chest X-rays often pick up harmless shadows caused by old infections or natural aging. But once a shadow appears, doctors usually feel pressured to investigate further. That can lead to lung scans and biopsies, procedures that carry a high risk of complications in older adults, including lung collapse and infection. Studies show that most of these findings turn out to be completely harmless, yet the testing itself causes real damage. Chest X-rays are valuable when symptoms exist, like chronic cough or breathing trouble. Without symptoms, they offer little benefit and significant risk. calm, empowering. Closing, these tests are not bad tests. They can save lives when used for the right reasons. But routine testing without symptoms can start a chain of fear, procedures, and harm, especially in seniors. You have the right to ask, why do I need this test? Will this change my treatment? Sometimes, the safest choice is not more testing, but better understanding. If you found this helpful, please share it with someone you care about. And subscribe, because in our next video, we'll talk about the medical tests seniors should never skip. Your health deserves clarity, calm, and respect.